Dalyn Miller of American Senior Communities is our guest. He's a registered nurse. Nurses are also primary caregivers in senior health communities. How has that role evolved, Dalyn?
It's really evolved where it's direct care now. We look at every patient from a holistic perspective, so their plan of care, just from administrative side all the way down to where they're receiving their medications and their treatments, ensuring that what our goal is to ensure that patients that are coming in for rehab are doing short-term stays where they're getting in and getting back home.
Is there growth for such positions, in the medical field?
Oh yeah, there's a lot of growth for nurses in our field. Again, kind of touched on, there's unit managers, medical records nurses, charge nurses that work the floor and the cart to do medications and treatments, but there's so many growth opportunities.
I've heard, and I've talked to a lot of people going to hospice care or other types of medical care. It's really a calling. As you look back on how you were raised and grown up and the training you've had, do you have to have a servant's heart, so to speak?
Absolutely. Yeah, you don't ever lose that. In my role, where I'm more of the administrative side now, still have that. I still have that, whether it's for my patients that I get to visit when I'm in buildings, or if I get to care for the nurses that I help along and counsel them. You don't ever lose that.
Also, as you look ahead into 2018, do you see even what excites you? Are there some even more advancements on the horizon? I
think so. Yeah, like I talked about, American Seniors is starting a post-acute service to really work on the rehab and helping patients get stronger and go home if they are more acute, as well as long-term patients. There's all kinds of growth that we're looking at.
If somebody would say, you know what, I think I'd like to consider a job in the nursing field, what advice do you have to him or her?
Yeah, the best thing, if you're going to get in it, it's a great field, great opportunity. You can always go by one of our locations, submit a resume, or you can also go online at ascseniorcare.com and go to links for careers.
And if they contact, we showed where there are 4 or 5 different branches of ASC here in the tri-state area. If they approached one of those facilities, might they find the proper information? They
will, yeah. We have openings at all of our facilities, and if they do go to a location where there's not an open position, we filter that out to other facilities that are local.
One more time, if you want to, what's the best way to get hold of ASC?
You can go to ascseniorcare.com and go to links and careers, or you can go to any of our locations around the state, which we have plenty. There's several, and you can just go and fill an application out or submit a resume.
Again, Dalyn, thank you for coming. Dalyn Miller is a Columbus, Indiana native. Thanks for your expertise, and I'm sure we'll see you down the road pertaining to ASC. Thanks, Dalyn.
Thank you.
When we come back, still need gifts for Christmas, but you need some unique ideas. Got a good person to talk to. Andrea Halbig, owner of Snickerdoodle